recently, we have also upheld the meeting about the prevention and control of COVID-19 in Guangzhou. And under that meeting, we have emphasized once again that the prevention and control of COVID-19 in Guangzhou is currently at a crucial stage. We should do everything we could to initiate all the effort to fight against COVID-19, and we are also going to adopt the more stricter measures to deal with COVID-19 and the scientific guidelines. And I also believe that we are going to do a good job in the prevention and control of COVID-19 emergency treatment to stop the spread of COVID-19 virus in Guangzhou. Today marks a new news conference. Today we are really honored to invite Madam Li Ming, the Vice Mayor of the Guangzhou City, Madam Shen Ying, Deputy Director of the Bureau of Transportation, Guangzhou City, and also Madam Guo Huan, Executive Vice Mayor of the Yuexiu District, member of the Standing Committee, and Mr. Fu Xiaochu, Executive Vice Mayor of the Haizhu District and member of the Standing Committee, and also Mr. Lin Xie, the Executive Deputy Mayors. Now the floor is given to Vice Mayor Li Ming to give us a briefing toward COVID-19 pandemic. Dear friends from the media, I'd like to brief you the latest update of the COVID-19 pandemic in Guangzhou. So I have three informations to brief you. The first one is the new features of the COVID-19 virus strains in Guangdong. On the 30th of May 2021, during the observation procedures of an asymptomatic patient in the hospitals, we discovered that across Guangzhou, we have reported around 30 different positive cases, among which 23 of them have been confirmed, and several of them are asymptomatic patients. So far, all the infected patients is being treated in the number 48 hospitals. After a very rapid screening work, we have identified the spreading routines and the trials, and we have also figured out the repeatings of the virus strains, and we believe the virus strain belongs to a mutated strain. This mutated strain has a shorter incubation period and is also spreading quite rapidly. From the current information, the majority of the virus strain is coming from the two different residential communities in the Liwan district, and all the different other relevant cases is also closely related to the two cases, and all the key areas has been quarantined and managed after the COVID-19 pandemic. According to the latest update, the spread of the disease, we believe the disease has been firmly under control. Secondly, I'd also like to brief you the prevention and control logic behind the COVID-19 new strains. I believe before the spread of the disease, we are going to screen the general public first. After these times COVID-19, we believe that these strains of the virus has been spread really rapidly. So we need to prioritize the prevention and control first in order to stop the virus to spread. And for this time, we have not only screened and tested all the different public places and also residential areas, we also invite the top-level experts to manage the areas which are vulnerable in front of the COVID-19. This is also going to give us more power of control in front of this new strain of the virus. On the 26th of May to the 29th of May, we started our screening job in the Liwan district. Starting from the 30th, after finishing all the screenings in the Liwan district, we have expanded the nuclear acid testing across the whole Guangzhou Municipal People's Government. We tested 48 streets, and including the Yuexiu district and also Haizhu district. We also have tested 8 residential areas in the Tianhe district and 2 different district areas in the city centers. By the 14th of the 31st of May 2021, we have tested around 3 million different samples. And through the expansions of the screening work and through the deepenings of the key areas, we believe the result for the positive patient is also going to increase. But we believe by the results so far, the infected people is only limited in a very few key areas. That is an indication that our epidemiological research has followed on the right track, and our prevention and control effect works. For the friends in our city who's living in the street, I believe that you should not be worried and you should follow the requirement of the residential community and follow up the nuclear acid testing work. And I want to emphasize once again that we are working really hard to mitigate the public health effect, and we are also providing all kinds of the necessities to the residents in our city. And I also want to kindly remind you that all the different supermarkets and convenience stores keeps opening 24/7, and the majority of the e-commerce platforms has enough food storage and daily necessity storage, and I believe that anything you ordered online is also going to be delivered offline to at your doors. So we have also built up a 24-hour alarming system, and we are also working against the clock to deliver the necessities and the food to different households. That is how we are guaranteeing the livelihood requirement of the people's requirement. Although we are making all on the effort, we are still having something that is not meet people's demand. We are still working really hard. So thirdly, we are also going to increase the measures for the prevention and control of COVID-19. And we have adopted measures to mitigate people's flow in and fro of the different areas. According to the different countries' conditions, we are trying to speed up the vaccinations of the citizens. Our city started the vaccination work of COVID-19 by the 16th of 31st May 2021. We have inoculated around 10 million people in our city, and we have witnessed that there is around 3.5 million people in our city has finished the inoculation process. Based on the current situations in our city, we have required the citizens to finish the nuclear acid testing. Based on the current situation, we are going to speed up the procedures for the vaccinations. And recently, we are also going to rearrange the vaccination work, and currently we are shifting the focus toward the key areas. And we are also going to stop the inoculation process of the general public. We have several different things that behind this logic. We are going to put the vaccination procedures for the medical workers and nurses who are fighting at the front line of COVID-19. So currently we have started the quarantining effort for the general public, and because the medics need to work at the front door, so we are going to vaccinate them first. And the second principle I like to share with you is that because of this wave of the COVID-19 outbreak, the whole society has a really huge demand for vaccination. Most of them is going to gather at the inoculation places. But I like to kindly remind you, gather up at the inoculation places are also going to spread the COVID-19 virus. So please be assured that we are going to reinitiate the inoculation requirement for the individuals. The second requirement is that we are also going to do a good job for the PCR testing for the retired people. And for those who are living in Guangzhou, we have required those of the vehicles who left Guangzhou is going to enter the scrutinies, and I believe that we are fighting against the clock to combat the COVID-19. This is also going to avoid the spillovers of the COVID-19, and we should shoulder our responsibilities in the national battle against COVID-19. Recently, we are launching around 276 inoculation areas for the COVID-19. And we are also going to set up the stations for the transportations, for the huge, large-scale trucks, and in order to get the testing result as quickly as possible for those of the citizens who are about to leave the Guangzhou, please avoid to go to the large-scale inoculations and also testing areas. We suggest you to go to the nearby testing and screening areas. And we are also I suggest you to go through the testing with your tickets outside the Guangzhou. Thirdly, we are also going to make our effort about the massive scale screening. So far, we have set up 1,782 screening sites, where 7,758 medical workers is working at the front line, and the daily screening capacity is reaching around 1.5 million people. And this is how we are going to guarantee the PCR testing at certain areas. To guarantee a good quality of the PCR testing result, the testing institution is going to report the positive result first. For those who have not received the result, please do not worry. And for these mutations of the virus, we adopted a dynamic changes to be adjusted to the prevention and control of the new strains of the virus. We are going to guarantee a smooth and stable life for the public. We really want to thank the effort of the public, and we also want to thank the frontline workers who are working at the front line. We also want to thank the spread of the informations of the medias, and I believe these images is going to become one hot memories of our city. Thank you very much. Thank you very much. I believe that we have invited Madam Li Ming, Vice Mayor of the Guangzhou Municipal People's Government, to brief us the latest updates of COVID-19 pandemic. And she have given us a very brief descriptions of the new features and characteristics of the new strains of the virus. The new strains has a very short inoculation period while it's spreading quite rapidly. For our epidemiological work, we have locked down the roots of these times waves of breaks. And here I also want to inform you that in the strong leaderships of our country and our provincial government, the logic behind these times of the COVID-19 outbreak wave is that we should put the prevention control first. And currently, we believe these cases has only been limited in a very few key areas. I believe that under the strong leadership, the epidemiological research has been on the right track and it is very effective. Now I like to give you some of the new arrangement for the prevention and control of COVID-19 strains to avoid the gather up of the peoples and also to readjust of the inoculation procedures. We kindly required all the citizens to understand us that we need to reallocate the vaccination to the key group of the people, the medical workers, and also the policemen who are working the front line of COVID-19. Starting from 10 a.m. tomorrow, we are going to start the screening and control for the COVID-19, and we are also going to give you some of the latest updates of the prevention and control. Today, we have a lot of friends from media attending today's news release. Now the floor is open up to the questions. Please identify your media affiliation before the questions. Thank you. With Danxia Daily. So my question is directed to the Deputy Mayor of the Haizhu District, the Deputy Mayor of Liwan District. Can you give us the latest update of the COVID-19 work in the Liwan District? Thank you very much for your question. After we have released the information of the level-based and layer-based COVID-19 prevention and control, Liwan District have adopted very strict measures for this COVID-19 break. According to the features and characteristics of this time's mutated COVID-19 virus, we have started the disease prevention and controls, and we have adopted measures that is higher than the current requirement. And today's morning, the Liwan district has released the number 4 public cities, and we are also working toward the Zhongnan district to lock down the Zhongnan district and also Basa district to stop any in and out of the local residents, require the local residents to stay at home. And all the daily necessities is going to be delivered at their front door. We hope that all the citizens living in the Liwan district would work together, work in unities to finish their PCR testing requirement. We are also going to implement the requirement with a strict measure. Currently, in the 5 street and 473 different crossroads has been locked down. In the Baiyuzhong street, we have circled 56 different grades, and in the Liwan district, we have also circled 30 different grades. And we are going to screen one grade by grade. For the left 3 districts, for each one of the households, they only allowed 1 people to get out of the household to fetch the daily necessities. So far, I believe that we have finished the first wave of the PCR testing for the Liwan district. Today's press release, today's result is being reported according to the massive scale PCR testing, and yesterday in the afternoon we started the second wave of the PCR testings. And I believe that at 3 p.m. yesterday, we have finished the samplings for 326 dozens of the samples in Liwan district. For those of the street who is under closed down, including the Zhongwan district, and I believe the street is going to, their daily necessities is going to be delivered by the logistic companies. We believe that some of the citizens reflected and reported that they have the vegetables to be delivered and they don't see any meats. We are quite worried and about that circumstances. Today we have set up 16 new different stations, and the delivery truck is going to be delivered at the front door. We are also speeding up the guaranteeing effort, and we are also going to create and connect the lost miles. Moving forward, we are going to add up the diversities. We really want to thank you for your understandings and for your patience. Finally, we are going to start the sterilizations effort in all the public spaces, especially for the sterilizations of the delivery trucks. Thank you very much, Vice Mayor. I think that recently you really keep all the eyes from the media are concerned about the district of Liwan in the city of Guangzhou, just as our vice mayor has reported us that all the effort is going to be made to guarantee the smooth living of the key areas, and we should not quarantine them. I believe that during their quarantining period, all the daily necessities is going to be supplied. And definitely, we cannot meet up all the different demands. And we are trying to connect the last mile. And we really want to thank for all the residents for your support, especially from the friends of the media for spreading the voice of our people's government. Now the floor is open up for the next question. Thank you very much with Southern Metropolitans. So my question is related to Haizhu District. On the 30th of May, Haizhu District has completed a all-rounded screening and sampling. What is the result? Can you brief us? Thank you very much for your question. In the Haizhu District, we have around 1.85 million people. And to conduct the PCR testing, we have set up 168 different testing stations in 16 different streets. By the 5 p.m. this afternoon, we have completed 2.7 million PCR testings, and we have completed around 860,000 PCR testing. Moving forward, we are going to continue the requirement with the people's government, and we are also going to closely follow the time slot-based appointment, and we are going to provide the tailor-made services for the general public. And we are also working together with the 3 different power suppliers to guarantee a smooth power operations in the sampling and screening stations. And we are also going to rearrange all the different necessities to cool the testing medics down. And we have also set up the special preparation areas for the college entrance examinations students. Thank you very much for the questions of the Southern Metropolitan Daily, and we really want to thank Mr. Fu Xiaochu, the Executive Vice Mayor of the Haichuan District. And in the Haichuan District, they have just started their all-out comprehensive testings, and moving forward, we are going to speed up the tailor-made testing. Thank you very much with CMG. So my question is that what kind of prevention measures is the USU district uptake so far? So how did you launch your prevention and control measures in the district of USU? Thank you. Thank you very much for the question. The district of USU started our prevention and control and emergency treatment measures on the 21st of May. We started the epidemiological research, PCR testing, inoculation, among other 3 measures by the 5 p.m. this afternoon. In the USU district, we have not figured out any single infected and confirmed cases. First, we started our work with the epidemiological histories. That is how we cut down the spread and control of COVID-19 virus. And we believe the epidemiological research should not stay overnight. And we have also emphasized the 3 people's group. And we have also guaranteed a major screening list for the district. We have also expanded the screening capacity and trying to figure out any single potential spreading causes. By the 5 p.m. this afternoon, we have managed 89 close contacts. And we have also screened and tested 141 people. And we have collected 356 samples from the environment. All the PCR testing results are negative. And through the PCR testing and also the exclusion measures, USU districts have figured out the result for these waves of the COVID-19 outbreak. We have tested 5 million public workers in the campaign against COVID-19. The residents and also the volunteers are really work hard to participate in the process. And the municipal government department is also come to our district. And yesterday it was the Sunday, and no single one of the governmental staffs rest. They have all been a part of the PCR testing management. By 5 p.m. this afternoon, we have set up 168 different sampling stations, and so far that we have collected 0.65 million people in the USU district. USU district also want to try to build a hurdle community by speeding up the inoculation procedures, and currently the daily inoculation number is registered at 30,000 people, and we have also finished 91% of the inoculation requirement. That is my answer. Thank you. Thank you very much for the question with CMG, and we also want to thank Madam Guo Fan for her answering. And Madam Guo Fan has used the word of to work with the COVID-19 virus by 3 different fronts. So from the result, in this afternoon, by 5 p.m., the PCR testing result has been completed, and the result is 100% negative. And the number that we have tested is around 91.5% of the total population in Yuexiu district. With Guangdong Television, my question is directed to the CDC in Guangzhou. What is the strategy towards these mutated strains of the COVID-19 pandemic? So, are there any changes to the prevention and control measures in front of these new strains of the COVID-19 virus? Thank you very much for your question. According to the PCR testing result, we believe that this wave of the COVID-19 outbreak is concentrated in the new strains. The new strain is spreading really fast. It has a very short inoculation period, and the latency period is only limited to 2 to 4 days. This has created a really fastened iteration spread. So that feature has determined that the prevention and control measures that we are dealing with these strains of the virus is quite different with what we have done previously. With these mutated strains of the COVID-19 virus and also the latest update of the COVID-19 pandemic, it has required us that we need to stay at home and we need to speed up our measures. It is just what our mayor has emphasized once again, that the prevention and control measures should go first, then the other different measures. And I believe that we are following the several different fronts. First, we are speeding up the epidemiological research. Currently, we are initiated a 300-member team to work in the 30 different districts of Guangzhou, and if the patient or if the resident is registered a positive result, we are not going to wait them to be confirmed, and we are also going to speed up our prevention and control measures before the COVID-19 confirmed cases. And secondly, we are trying to add up the requirement for the PCR testing. And we have also researched into the close contact and also the second close contact person, because all of those people has been working in the different districts. On the 26th of May, we started the all-aunt PCR testing in the Liwan district and also the Haizhu district. For other different districts, we have initiated very targeted exclusion measures. The spreading of these sampling measures is actually helping us to generate the second fireproof walls. And this is also going to help us to figure out the potential infected patient. And thirdly, in terms of the management of people and of the public places, we have changed the previously confirmed cases centered prevention and control measures to infected area confirmed cases. After we have launched that requirement, we have goes into the different several layers, and we generated 3 different circles: the key circles and also the intermediary preference and also the external part of these controls. And we have came up with a differentiated measures in these 3 different circles. We believe that by using and launching these different 3 fireproof walls, we are going to lock the virus within the smallest area. We are racing against the virus. And at this crucial stage, we need to join hands with each other, and that is how we are going to win the battle against COVID-19 and resume our daily life and work. There might be some of the residents in Guangzhou who really cares about the newly reported infected cases. It has been increasing quite rapidly compared to the previous days. If you look this number from a scientific measures, because in the recent few days we have sampled more people, and the newly added number is coming from the second close contact and the secondary close contact, and another major part is coming from the large-scale screening. The epidemiological research indicates that they are on the same epidemiological trends. The friends, the families, those who share the same table in one restaurant. And currently, there is no single cases which is standing on top of other different infected cases. So through all-out comprehensive screenings and samplings, for one part, we can control them quite rapidly. For another part, we are going to detect those who have been affected by COVID-19 while we are working really hard to race against the virus. It also needs the time to complete the job. I believe that with the implementations of the prevention and control measures, the result is going to demonstrate itself in the following few days. And the newly added cases is located in the central circles for the prevention and control measures. And currently, they are still centered in the lower temperature area. And in other different key areas, we are trying to add up the effort in the screening measures. And I believe the result demonstrated that the spread of the new strain of the virus is only being limited to a very small area. If we have the support with all the different residents in our cities, and if you have supported our level-based and layer-based requirement to reduce your social activities and keep social distance, we are going to control the virus to spread to the periphery of the Guangzhou city. Another part I want to mention is that with several days of the efforts, the spread of the disease has been stopped. We have one calculation that the R0, the indicator for the spreading, has been reached at 5 at the 26th of May. It has reached its peak to 6.22 at the 29th of the May, and yesterday the number has been dropped. So you might not understand what is the indication behind it. That is a very important figure toward how one confirmed cases can confirmed. How many people can one confirmed cases affected? The COVID-19 confirmed cases generally have an R0 of 2 to 3. But so through this new R0, you will figure out the difficulties of these times prevention and control of the COVID-19 pandemic. This has required us to adopt the stricter and steadfast measures. The regular measures that we have adopted so far cannot only meet up the requirement. This time, we need to speed up, and the drop of R0 is also a very comprehensive indicator that the current prevention measures works. I believe that once the prevention and control measures, it is going to take some of the time. I kindly ask all of you to be patient, and I believe that after wait for several few days, we are going to see the real good result. Starting from the 26th of May, we have adopted a very strict requirement. For one part, all the prevention and control frontline medical workers is going to make all-out effort to do this part of the job. But we also required all the citizens, all the residents in our city to support these measures, to adopt these measures. And I believe those who are living at the core areas of these waves of outbreak, please stay at home. And those who are required to stay at home 100%. And for those who are living inside of the alarming circles, you should also reduce the social activities and you should not get out of the doors unless it is necessary. And citizens from other different districts should also abide by the requirement. Do not be you should I believe these residents should also focusing on their own self-care testing. And after we are joining hands with each other, we are going to prevent and control this wave of COVID-19 outbreak and resume our daily life and work. That is the most effective measures. Thank you. That concludes my answer. I really want to thank the friends from the Guangdong televisions, and I also want to thank Mr. Zhang, the Deputy Director of the CDC Guangzhou, for your answer. I believe that hearing his answer and also Madam Li Ming's answer, we believe that we have a clearer picture toward the times of the COVID-19 outbreak. And just as Mr. Zhang has mentioned, that we have speed up the epidemiological research and also the prevention and control measures. And I believe that through the work in the early stage, we are going to get a very clear conclusion that the newly added cases is majorly comes from the close contact and the secondary close contact. And so far, the newly added close contact is in the core areas that is under close management. And I believe the RO ratio is being mitigated in the Guangzhou city. So we really want to kindly invite all the friends from media to spread the voice of our CDC director. So please stay at home. If you are at the core areas, please reduce your social activity at the alarming areas. And for those who are living in other districts, you should also work on the prevention and controls. We required all of you to wear medical mask at every single public place. Starting from ourselves, we are going to prevent and control the COVID-19 pandemic. So I am with the Guangzhou television and radio of Guangzhou. My question is directed to the Deputy Directors of the Transportation Bureau, Madam Shi Ying. I believe that you have mentioned that those of the transportation truck who are going to leave Guangzhou at 72 hours, they are going to demonstrate a PCR testing result. Thank you very much for your exposure. And at 10 p.m. tonight, we are officially going to publish such effect. Let me give you a very brief introduction toward that part. And the name for this poster is that we are going to strengthen up the requirement for those who are living in Guangzhou. For one requirement, those of the public transportation vehicles or those of the visitors who are left out of Guangzhou through the airport, through the railways, and through the highways, those of the tourists who are about to leave Guangzhou, they should provide a 72 PCR testing negative result with the green QR code. But for those of the highways who are operating as the metros who are operating intracity metros, just like operating like intercity metros, it should follow the same requirement. For those visitors who need to get out of the Guangzhou, they can get some of the prioritized PCR testing. If they cannot get the PCR testing result, And if the visitors who cannot start their start their journey in a timely manner, we provided a free of charge return and rebate. The second requirement is for those vehicles who are leaving Guangzhou, we require the driver to provide a 72-hour PCR testing. And for those of the privately owned vehicles, all the transportation trucks and also the tax and also the online testing, and they don't need to provide a PCR testing result. The second question is also the third item for our information, and for those of the trucks, combining with the features of the transportation features in Guangzhou, we provided free of charge PCR testing results for those drivers. And moving forward, we are going to set up 10 different testing for bio-industry. We are going to set it up the 10 different PCR testing stations, and moving forward we are going to add up more PCR testing stations, and we are going to provide free of charge PCR testing for the truck drivers, and we are also going to do a very good maintenance job at the site. Thank you very much. Thank you very much for the question from Guangzhou Television and Radio of Guangzhou. We also want to thank Madam Shen Ying, Deputy Director of the Transportation Bureau. I believe that since the first announcement, the citizens actually cares about how can they live out of Guangzhou, and I believe after releasing this announcement, you are going to have a clearer picture toward the details in the city of Guangzhou. I kindly remind all of you to focus on the press conference from the municipal government of Guangzhou. We are in the middle of an unprecedented battle against the mutated strains of the COVID-19 virus. We are also going to adapt the strictest measures in this wave to control the gather up activities in the medium risk areas. And we are also going to work really hard at the community level to manage those people who are going to stay at home. And we are also going to strengthen the measures to prevent the imported cases and trying to avoid any export cases. And in these few days, we are going to start. We are going to give you the press release every single day. We have also want to thank all walks of life from the society for your support, and it is also going to be a very important memory in the history of Guangzhou. Yesterday, I also want to introduce you that there is some of the coverage from the media mentioned that those of the frontline medical workers fight at the Wuhan's frontline has also continued their effort at the frontline of Guangzhou, and I believe it is going to be engraved in the national memory. And yesterday, we also see some of the articles from the media, and some of the volunteers that they are willing to work overnight, and we are seeing some of the kids who are born after 2000, and they are willing to work overnight to support the prevention and control measures of COVID-19. We have also seen the professional medical workers working at the Zhongshan University to provide the professional PCR testing, and for the students and the college students of PCR studying at the Zhongshan University, they have given them their firm support. On the afternoon of the 29th of May, and when the heavy rain has hit the PCR testing station, the frontline workers have supported us, and they have also supported our testing. And there are so many moving stories reported in this battle against COVID-19. I believe that while we are joining hands together, we are definitely going to race against this COVID-19 pandemic. That concludes today's press release. Thank you very much for your support and participation.